Hey everyone, Dr. Charlie Johnson, physical therapist, back pain specialist. If you're watching this video, you've probably taken my Piriformis Self-Test, where I gave you basically three self-movement tests you could determine whether or not Piriformis Syndrome is actually the cause of your buttock pain and or sciatica, leg pain, numbness, tingling, whatever it may be, all right? So if you watch that and you said, okay, Charlie, like I have Piriformis Syndrome, what do I do about it? And or you've been trying your own self-treatments, likely you've been trying to stretch it out by pulling the hip over and across the opposite shoulder, feeling a good pull in the buttock, maybe even stretching out your hamstrings, whatever it is, it's just not working. Well, then this is for you. So consider this. This is a muscle. It's a rubber band, all right? Consider this is the piriformis muscle. So you have point A and point B, right? Well, lengthening it, right, would be stretching the muscle. So that's how most people approach treatment of Piriformis Syndrome, is that they try to stretch it out or make it longer because it feels tight. Well, I'll be the first to say that if you've gone through my self-test and Piriformis Syndrome seems to be the likely cause of your buttock pain, leg pain, numbness, or tingling, then understand that most of the time the muscle actually needs to be shortened. All right, so I can't tell you how many times I see people with Piriformis Syndrome who just continue to stretch out their piriformis. So they try to improve the flexibility or the length of the piriformis muscle, when in actuality the answer is that they need to make it shorter, right? So they need to, just understand this. How do you lengthen a muscle? You stretch it, right? You take point A and point B further apart. Makes sense. How do you shorten a muscle? So just think about that. So you shorten a muscle by contracting it. So when you lengthen a muscle or you stretch it, right, you pull the properties within the muscle sort of further apart, all right? When you contract it, right, and you get that little bump or that little contraction, you actually shorten the muscle. The elements within the muscle kind of grab onto one another and they overlap more. So by shortening the muscle or repeatedly contracting it and strengthening it in a shortened position, you can often relieve pressure and tension through the piriformis muscle. So consider that many people with Piriformis Syndrome actually have a muscle that's on strain. It's annoyed because it's too long and you keep stretching it. Is it possible, I could be right or wrong, you give it a try, but is it possible that by shortening it and taking some of the tension off of that, right? So now you're taking a muscle that's long and sort of can't function very well, and now you're making it nice and stiff and short such that it can actually have the ability to contract and do the work that it needs to do. Again, test it out, but I'm going to show you a few ways to do that now. So first things first is that you need to actually determine, should you be stretching it or should you not be stretching it? And here's how you can kind of tell. So just do this self-test. Let's just say that you have your left buttock and leg is fine, your right one is where you have symptoms, all right? So let's test the good leg first. So go ahead and just cross it up here and push the hip down. So this motion, right, is kind of assessing the length of the piriformis. So you're going to kind of see what motion you have there. You can see from the camera, right, from like a straight down angle, I don't know, I've got 70 degrees, something like that, of rotation in the hip, right? Now do the other side. If this side is the one where you have Piriformis Syndrome and you have the same exact amount of motion, so mine are pretty symmetrical, right? I have about 70, 80 degrees of rotation on this side. Well, if you have the same motion in the hip and you're thinking that piriformis is tight on one side, that just can't be really possible. And it doesn't really make sense, because if the hips move exactly the same and stretching the hips and making them kind of move better is the answer, well, number one, why hasn't it worked? And number two, why don't you have it on the other side, which moves exactly the same as the side where you do have pain, right? Hopefully that makes sense. So what I would say is that often I see people have excessive hip motion. So these people start here and they push down and I can't go that far, but they can get their knee all the way down to the table. So they have a lot of rotation in the hip. And a lot of these people sit with their leg crossed. So they're habitually lengthening this piriformis muscle, and they go to yoga, they watch YouTube, and they just try to lengthen the heck out of this thing, when in fact they should be doing the opposite. Stop crossing your legs during work, and actually strengthen it, all right? So point is, if you have excessive motion on both hips, then you definitely don't need to stretch it. If it's the same, you probably don't need to stretch it, and here's when you could perhaps benefit from stretching it. So again, if this is the good leg, and you put it up and you've got great motion here, oh, it moves really well, all right? And again, you've got, I don't know, 70, 80 degrees there, right? And then you go to this hip, and it's like, you just can't quite get it on up, and it's very stiff, and the knee won't go down, it won't kind of come up, it's just super stiff, and it's clearly different, then yeah, that might be a reason that you might want to go ahead and try to stretch it, to try to make it symmetrical. But if it's symmetrical, and especially if it's excessive, like you can get your knee, kind of like parallel or in line with your foot, or you can get it all the way down to the table, please do not stretch the hip anymore. Instead, try these two things, okay? So if you've been trying to stretch the heck out of your hip and it's not helping your piriformis syndrome, try these two things. Okay, so the first one you're going to do is a really simple exercise as far as like setup. But you'll actually find probably, if this is something you need to be doing, it might be quite challenging. So you're going to lay on your side so that the leg that hurts or the buttock that's bothering you is up, all right? Notice my knees are bent, my feet are together and rested on the floor, my heels are together, okay? Just find like a natural position. Your knees shouldn't be up really high, they shouldn't be in line with you, they should just be slightly out front. With the heels together, hands on hip here, you're going to just rotate upwards as far as you can. Now, what I don't want you doing is rotating upwards and rotating your whole body, all right? Your hand is here such that as soon as you feel this start to rock backwards, you stop. So, if you have good hip motion, it should look something like this, all right? And what you're going to feel if you're doing this correctly and you're keeping your heels together is you're going to be able to squeeze kind of in the upper outer hip area, all right? Now, to get used to the motion, start with just maybe 15 to 20 reps. Maybe that's stage one, all right? So you do this every day, once in the morning, once at night, and you go for 15, 20, heck, even 30 reps. You just get, you just get the motion of the exercise. You learn what the form should be like. You get to find like that tipping point, and you really get the quality of the movement down, right? And then once that gets easier, the goal is that you shorten the muscle, actually bring it closer together, okay? And you hold it there. So you hold it in a shortened position, all right? So what you would do is you would hold your hip here, get in this end range position just before you start to rock backwards, all right? And hold it there. And you would hold that there for up to a minute. And then after that minute, you can go to the other side, hold it for a minute, and you would hold it for a minute up to 3 times on that side where you really feel a burn and a lot of work in the hip area, okay? So starting with repetitions to get the quality of the motion, and then going for 1 minute, 3 1-minute holds at that tipping point, okay? So that's the first one. All right, the second one is a bridge with hip rotation, all right? So if you have a band, great. If not, just use like a bigger belt that you have or loop a couple belts together, and you're just gonna put it around just above the knee. So again, you can take a belt and kind of loop it and cinch it up there, okay? So what you're gonna do is you're gonna be on your back, just like in this position, not too far out, that'll work your hamstrings, not too close, just kind of find a comfortable position. Knees about shoulder width apart, maybe a little bit more narrow. And what you're going to do is you're going to lift up, and then at the top, you're going to push out gently against the band. You're not going all the way out as far as you can. You're just pushing out a little bit until you feel tension in the back part, like your backside and your outer hips. And again, you can, if you want, go for repetitions. Lift and out, down, lift and out. Or you can go for hold. So you can hold this position for, again, up to a minute 3 times. And you'll feel good workout in the buttocks and the outer hip. So with that being said, try those 2 exercises if you notice that you have really good and symmetrical motion on either side of your hips, and you've been trying to stretch your piriformis and it just hasn't been working. instead consider that instead of more length, maybe it needs to be shortened. So you do that through strengthening and contraction. So hope this helps. Leave comments below.